Hi there, I'm Dr. Alice Hoyt. I'm a board-certified allergist and I volunteer my time with the Code Ana program. I wanted to take a few minutes and talk you through anaphylaxis because, well, it can kind of be confusing. So the graphic that you have on your screen depicts the 3 criteria for anaphylaxis. What this means is that there can be more than one definition of anaphylaxis. So let's go through this. At the very top of the screen, what you see is anaphylaxis is likely when one of the following 3 criteria is fulfilled. So what is one of those following 3 criteria? It can look like sudden onset of illness of the skin, lungs, or both. So that means hives, itching, flushing, or swollen lips or tongue. So that's sort of one system, right? Your cutaneous, your skin system. Plus coughing, wheezing, stridor, that sound that comes out when it seems like the throat is closing, or shortness of breath, or reduced blood pressure, collapse, sudden incontinence. So over here in the first criteria, it's basically skin symptoms plus respiratory symptoms or a drop in blood pressure, collapse. So that's one definition of anaphylaxis. And I want to pause right now to really highlight that reactions can happen within minutes to hours of exposure to an allergen. And when we're talking about exposure for foods, that's going to be actually ingesting even the smallest amount of the allergen. For things like bees, that can be being stung by a bee if you're allergic. And then medications are another common cause of severe allergic reactions, meaning anaphylaxis. Another definition, or the second criteria, is here where you have 2 or more systems involved. And this is probably the one that you might be more familiar with. And you've heard 2 or more systems. So what does that mean? That means that you can have skin symptoms involved, again, hives or itching or flushing or swollen lips. That's one system. Another system is the respiratory system. So again, coughing, wheezing, stridor, and or shortness of breath. So any of these, that makes that system count. Another system is the GI system, the gastrointestinal system, and that'll be nausea or vomiting or abdominal pain, or all of them. So that's your GI system. And then the fourth system would be this circulatory system where the blood pressure drops, you can have sudden collapse, and you can have incontinence. So in this definition of anaphylaxis, you can have 2 or more systems involved. So you could have skin and vomiting, you could have coughing and hives, and that again meets criteria, the second criteria for anaphylaxis. Okay, I want to take a moment right here while we're in criteria number 2 to really focus in on recognizing anaphylaxis in our younger kiddos who can't necessarily describe, Mrs. Smith, I'm having nausea. So in a young kiddo, you might recognize really just one symptom. You might visualize hives. But what you need to be looking for and asking the kiddo is, how do they feel? And if they say they don't feel good, or my chest feels funny, or my stomach feels funny, or my heart feels funny, or my mouth feels funny, or any of that, that needs to go into this decision making of whether or not this little kiddo is having anaphylaxis. Because it's quite possible that what's going to happen when a child, especially a younger child, begins having an allergic reaction after ingesting a food allergen is they'll start having hives, but they'll also start having nausea, and they might stop eating whatever it is they were eating because their stomach doesn't feel good. And so even though they're not actively vomiting at that point, they are having 2 systems involved. They're having hives and they're having that GI distress. So just really be thinking about, is this child having an allergic reaction? And use your skills as an amazing mom or dad or childcare provider, teacher, coach, nanny, whatever you may be as that child's care provider at that time, use those skills that you have to know that child and recognize when that kiddo is not acting themselves, and consider, especially after eating food and especially in kiddos with known food allergies, whether or not they're having anaphylaxis. So what is that third definition? What are those third criteria for anaphylaxis? That's going to be over here, reduced blood pressure after exposure to a known allergen. So this is in someone that you know has an allergy, they ingest their allergen or they're stung by a bee, and then very suddenly they have reduced blood pressure. This is not one of the criteria that's commonly used in the field, because it can be really hard to know if somebody has reduced blood pressure. Of course, if they've passed out after they've been exposed to an allergen, then you kind of know right there, okay, their blood pressure is probably low. And in all of these cases, as soon as these criteria are met, so either skin plus respiratory or circulatory, or 2 or more systems, or drop in blood pressure after exposure to the allergen, then you know you have anaphylaxis. And a little bit more about this drop in blood pressure. There are very specific numbers involved regarding how much blood pressure would drop. And that's because children have different normal blood pressure than adults. But because this is more aimed towards our amazing childcare providers, teachers, parents, people who are not necessarily medically trained, don't necessarily have a blood pressure cuff with them all the time, we really like to focus on these 2 definitions of anaphylaxis. So I hope that you're enjoying this course. Of course, whenever you have questions, reach out to us.